Welcome. Have you ever wondered about the silent threat lurking around your heart? Today, we're diving deep into pericardial effusion, a condition where fluid builds up around the heart. Join us as we explore its causes, symptoms, diagnosis, and management, so you can better understand this potentially serious cardiac issue. So, what causes this fluid buildup? Pericardial effusion can arise from a variety of factors. Infections, both viral and bacterial, are common culprits. Inflammatory conditions like lupus or rheumatoid arthritis can also trigger it. Kidney failure, cancer, injuries to the chest, and even certain medications can contribute. Sometimes the cause remains a mystery, which we then classify as idiopathic. Now, let's understand how pericardial effusion affects the heart. The pericardium, a sac surrounding the heart, normally contains a small amount of fluid. When excess fluid accumulates, it puts pressure on the heart. This pressure restricts the heart's ability to pump blood effectively. If the pressure builds up rapidly, it can lead to a life-threatening condition called cardiac tamponade, where the heart is severely compressed. Pericardial effusion can affect anyone, but certain populations are more susceptible. Individuals with autoimmune diseases, kidney failure, or cancer are at a higher risk. The incidence also increases with age. While precise statistics can vary depending on the study and population, understanding these risk factors can help in early detection and management. The signs and symptoms of pericardial effusion can be subtle or dramatic depending on the amount of fluid and how quickly it accumulates. Common symptoms include chest pain, shortness of breath, especially when lying down, palpitations, lightheadedness, and fatigue. In severe cases, symptoms can progress to dizziness, fainting, and even cardiac arrest. Swelling in the legs and abdomen may also occur. Diagnosing pericardial effusion typically involves a combination of physical examination and diagnostic tests. A doctor will listen for muffled heart sounds, a telltale sign. An echocardiogram, which uses sound waves to create images of the heart, is a crucial tool to visualize the fluid and assess its impact on heart function. Chest-raised CT scans and MRI scans can provide further detail. In some cases, a pericardiocentesis, where fluid is withdrawn for analysis, may be necessary to determine the cause of the effusion. Pericardial effusions can be classified based on the speed of onset and the size of the effusion. Acute effusions develop rapidly, posing a higher risk of cardiac tamponade. Chronic effusions develop gradually, allowing the pericardium to stretch, which may delay the onset of severe symptoms. Size is categorized as small, moderate, or large, based on the amount of fluid seen on imaging. Treatment for pericardial effusion depends on the severity and underlying cause. Small, asymptomatic effusions may only require monitoring. For larger effusions or those causing symptoms, treatment options include pericardiocentesis, a procedure to drain the fluid using a needle, or a pericardial window, a surgical procedure to create an opening in the pericardium to allow for continuous drainage. Medications to treat the underlying cause, such as antibiotics for infections or anti-inflammatory drugs for autoimmune conditions, are also crucial. While not all causes of pericardial effusion are preventable, certain measures can reduce your risk. Managing underlying conditions like kidney disease, autoimmune disorders, and cancer is important. Preventing infections through good hygiene practices, such as hand washing, and prompt treatment of infections can also help. Avoiding excessive alcohol consumption and certain medications known to cause pericardial effusion can further reduce risk. The prognosis for pericardial effusion varies depending on the underlying cause, the severity of the effusion, and the timeliness of treatment. Early diagnosis and appropriate management generally lead to a good outcome. Recent research is focusing on developing less invasive techniques for drainage and identifying biomarkers to predict the development and severity of pericardial effusion. Further understanding the genetic factors involved and the role of inflammation is also a key area of ongoing investigation, ultimately aiming for more personalized and effective treatments.